The governor asked me to give you an update on how we are doing in the hospitals. We knew that when we went to phase 2 that we would see a little bit more community spread, and that community spread would result in a few more admissions to the hospital. And we were prepared for that because we had been through this before. What we weren't prepared for was the steep escalation in hospitalizations that started about 10 days ago. We have quadrupled the number of patients in our own hospital, and we've seen similar numbers throughout the state. This massive increase in admissions was not expected. What we expected was to see a slow community spread because people were still socially distancing and masking, but that wasn't occurring. And now we are overwhelmed. We have too many people in the hospital. Our hospitals are full. When our hospitals get full, just like we talked about before, it is incredibly hard to provide care for everybody. I want to give you a glimpse of the people that we're seeing in the hospital today. Of our patients with COVID-19, a third of them are in the ICU. Our youngest patient is 25, and he had no medical conditions when he entered the hospital. As you see those age ranges increase in the number of community cases, we see those same admissions increase in that age group, and that's what we're seeing today. We have patients in their 20s, we have patients in their 30s, and in their 40s, and in their 50s in the ICU, and they're struggling for their life. Those patients require a tremendous amount of care. When you admit them, they look pretty good and they need some oxygen. And when they get to their bed on the floor, they're fighting for their life and we're rushing them into the ICU. And this is a nightly occurrence in the hospital. It takes a tremendous team to do that work. And that team can no longer offer care to everybody else who needs care. Those people who are waiting for a bypass surgery because they have heart disease, those people who are waiting for a joint replacement because they haven't been able to walk in 6 months and we've already put off their surgery once. And those people who have a mass and are waiting for a diagnosis of malignancy. One of our palliative care doctors shared with me this week that she saw a patient in clinic this week whose surgery was put off in February and again in March and again in April. And by the time that patient was diagnosed, they had metastatic disease and they're no longer capable of having a cure for their cancer. We can't allow this in the community anymore. We have to be better stewards so that the whole community is healthier from all of their illnesses and not just COVID-19. But to do that, we have to do things like masking, and we all have to wear a mask. I have to wear a mask, and I have to demand that if I'm going to have a conversation with you, that you also have a mask on. And by doing that, we protect our community, we protect each other, we protect our families, and that's how we end up safe at our homes and not also patients in the hospital with COVID-19. The medical community asks the citizens of Louisiana, our community members, to help us to decrease the spread by thinking about each and every interaction you have socially with another individual, whether it's in your backyard, whether it's at work, whether it's passing people in the hall. Keep your distance. Try to have that interaction on Zoom or by phone if you can, and keep your mask on and ask them to put their mask on. We've seen this have huge implications in the hospital and keeping our patients safe, and so we know that it works, and we know that if you do it, we can continue to provide everybody the expected quality of care that we expect to give people every day. We appreciate your participation for the community and for the safety of our patients. Thank you, Governor.